Hello everyone, my name is Saad Usmani. I'm joined by my colleague Dr. Sham Mailankody, and we are the co-chairs for the first international workshop on GPRC5D targeted therapies in multiple myeloma that has just concluded in New York. It's been a fun day of discussions and talks, both from a basic translational as well as clinical standpoint. Something that we are all learning about these modalities and therapies today. There were a lot of discussions around how within a short span of the first paper coming out focused on myeloma, originally published by Eric Smith, to where we are in the field right now. So we had international participation. We learned a lot from each other. A lot of good projects also came out, and I want to just ask Sham about his thoughts on what were the key takeaways for us.
Thanks, Saad. Yes, I think this was a very interesting meeting because, as you said, GPRC5D is still a relatively new target. And in fact, as you know, we don't really know what the function of GPRC5D is in normal human tissue. So there's a lot of unanswered questions about this very important topic. And therefore, I think it was very exciting to get some of the basic scientists, laboratory researchers joining with us, those of us who see patients, treat patients with these drugs, to talk about how to best understand this target, how does it work in multiple myeloma, and then, as you again know, there's some unique toxicities and challenges with targeting this protein in multiple myeloma. So there was a lot of robust discussion around practical aspects of managing these toxicities, identifying these toxicities, maybe even preventing or avoiding these toxicities in the long run. So I do think that we all learned a lot from each other. The discussions were very lively. There was a lot of different viewpoints that came up, both from the laboratory and on the clinical side. So I think overall, we are all leaving this meeting with a lot better understanding of where we stand with GPRC5D and what needs to be done in the coming years that hopefully we can all work together on.
No, I completely agree with you. And the only thing that I would add is I was impressed with the participation from the younger investigators and the trainees who were in the crowd as well. And it's really encouraging to see them being thoughtful about the questions that were coming up, and also asking some really interesting questions. Hopefully, when we come back next year to you guys, we'll have better answers and even more robust participation. So until next time.